Food insecurities have grown in our area during the pandemic. To talk more about this is Janice Tosto. She is the Health Enterprise Zone Project Coordinator for Bebashi Transition to Hope. Her project addresses food insecurities in 14 zip codes. 14 zip codes in North and Northwest Philadelphia. Welcome, Janice.
Thank you, Amanda. Thank you for having me.
It is a pleasure. I'm looking forward to our audience hearing more about this. Please tell us more about Bebashi and what your role is.
Sure. So Bebashi is an organization that helps marginalized individuals take control of their health, and their general welfare. And we do that by providing high quality medical services, sexual health screenings. We also provide HIV/AIDS case management services, and we provide access to other social services. And as you said in the introduction, my role is that of the Health Enterprise Zone Project Coordinator for Bebashi, and I've been with the organization for 2 years. And the Health Enterprise Zone Project, again, it covers 14 zip codes in North and Lower Northwest Philadelphia. And these zip codes were identified as communities that needed additional health and wellness resources.
Awesome. That sounds like a lot of different areas and different things that you guys cover. So how has serving the community changed since the pandemic?
Well, during the pandemic, we made the decision to keep our doors open because we are a public health organization and we knew that there would be a need for our services. So we continue to provide our case management services. We continue to provide sexual health screenings. It was interesting because more people were coming through our doors during the earliest stages of the pandemic to get sexual health screenings. Our Food First Pantry, we expanded the hours. So whereas we would, before the pandemic, we were open a couple of hours a day, we expanded our pantry hours from 9 a.m. to 4 p.m. Monday through Friday. We also allowed folks to come to our pantry twice a month instead of once a month, and we waived the requirement for a referral because we recognize that because a lot of Philadelphians had lost their jobs, that there would be a greater need for our food pantry services. And we were right. We served upwards, I want to say about 8,000 folks last year between March and April, and then into I would say like July later on in the year. But we served like double our numbers, actually double our annual numbers in a matter of months.
So did you find that you guys were getting more resources pulled in due to all that you already did? Did you find that you were getting the additional resources?
We did. Staff was able to work in the office. We had a different schedule, so folks were able to work at home some days, and then we were in the office. But yes, our food pantry, thank goodness we didn't run out of food. We were still able to provide our case management services. Those services moved from in-person to virtual. And then if clients really needed to come into the office, like we made appointments, so we didn't have a lot of people coming into the office because we were really trying to practice, the COVID protocols, the social distancing, the wearing of the mask. So things changed in that regard. But, again, our doors stayed open and we continue to serve folks.
And you said, when we were talking earlier, you said something about you guys were one of the first to do outreach for HIV. I don't want to put words, but you said something about HIV being specifically one of the areas that you guys supported.
Correct. Yes, we are one of the oldest Black-led HIV/AIDS services organizations, not just in Philly but in the country. And we've been around for 35, going on 36 years. And 67% of our clients identify as Black and or African American. But yeah, we've been around a while.
That is awesome. So I know a lot of people that may not be familiar with the program, but you said 14 zip codes in North and Northwest Philadelphia you guys service. So if someone said, well, I want to know more about Bebashi, what
Mhm.
are the steps for them to get connected to you guys?
Well, let me just clarify. So Bebashi serves residents throughout Philadelphia. My particular project, the Health Enterprise Zone project, our focus is on those 14 zip codes. So the services that we provide, so for example, the Health Enterprise Zone project has three major components to it. So we do a lot of outreach in those 14 zip codes. So we go out and we talk to people about the services that Bebashi offers, specifically our food pantry services, because our project addresses food insecurity. So we do a lot of outreach, get out and talk to folks. We distribute food when we're doing outreach. Earlier this year in January, we published a resource guide. So there are resources for those 14 zip codes in that resource guide. So we have resources for we have resources for food. We have resources for healthcare, for government services. And then we also support or operate for school-based food programs. We used to call them school pantries, but my team and I decided that we would stop using the word pantry because for some children, there's a stigma attached to it. So we've decided to call our school food distribution program Bebashi Has Eats. So that way it's a cuter name and it takes away the stigma. So so we have 4 schools. One school, we actually have a partnership with another organization. So we provide them with food for their school, for their school program, food program. And then we actually go to other schools and we bring food to the students and the parents who request the food bag from us.
Awesome. So they can come to the location, or you just deliver them all to the different schools?
No, we deliver the food to the schools where we have the school food programs. That's what we do. And how we arrived at the contents of the food bags is that we, in the beginning, we met with the schools, we had conversations about what the parents and the students would like to see in the bags, because we didn't want to make any assumptions about what folks wanted to eat. We wanted to make sure that the food was nutritious but also culturally relevant. That was very important to us. So we ordered food that the students and the parents said they wanted to eat. So we ordered the food, we put the food in bags, and we transport the bags to the schools and we distribute them to the students and parents. And it's on an as needed basis. The parents can sign up and they can take advantage anytime that they need the service.
Wow, that is awesome. To be strategically, that means that you guys are talking to the people. You're communicating.
Yes.
You're not just saying,
Correct.
hey, take this. You know what? No, let's see what you need. We are
Correct.
hands-on. So when you when they're parents, because I know this is a big thing, especially with kids not being able to get breakfast and at school or only time they're able to eat. So if someone do they have to be a part of the program already, or can they reach out to you to try to connect to get on this the we don't want to say the lunch the schools because I understand, and plus your saying was so cute anyway. I like the way you said it, but to get on the lunch program, that specific program, the way you said it was much cuter. But how do they become a part of that? Because I know there'll be some parents like, I would love to get my child a part of that, but they may not have known about it. What would be the process to get connected with that?
Well, unfortunately, we don't have projects in every school. Our proposal, we said that we'd reach out to 4 schools. So that's how we, that's how we decided upon the schools. We asked, some of our community partners. I'm sorry, my headphones are sort of jiggling here, but so we asked some of our community partners to make some recommendations on some schools that they felt would want our service. So that's how we arrived at the schools that we currently service. We would love to be able to get enough funding to serve more schools. That would definitely be, a goal of ours, to have more funding to reach out to other schools. But parents can always, if they choose, they can always come to our Food First Pantry for nutrition assistance.
Awesome, awesome. Now, you were recently able to connect with Dr. Randy Smith and bring her research on relationship between food insecurities and gun violence. How was learning about her research and meeting with her able to impact your organization?
Meeting Dr. Smith was really a godsend for us. My practice, when I come to work each morning, when I turn on my computer, I check my emails, but then the next thing that I do is I look at the newspaper just to see what's going on in the city. And like so many of us, I read these stories about gun violence, and it's just so heartbreaking. It is so heartbreaking. And one day I was sitting down in my office, after having read the paper, and one of my coworkers was in the office with me, and I was sitting there, and I just kept shaking my head and saying, we've got to come up with some solutions to this. I know that there are solutions. And I thought about what we do in our space, and I said, is there something that we do? So we address food insecurity. Is there something that we can do to be part of the solution to ending some of this gun violence? And I'm thinking out loud, like, what is the connection between food insecurity and gun violence? Now, my coworker, Liam, who is a college student, left my office, came back a little later with a research paper entitled "Food Insecurity Predicts Urban Gun Violence," Dr. Randy Smith. And I took one look and said, oh my goodness, I have got to read this. I read the research paper and I said, wow, I'd love if we could have a conversation with her. So I took a chance, sent her an email, because sometimes, people are really busy and you send them emails and they never respond. She responded immediately and she said, thank you so much for your email. Yes, I would love to have a conversation with you about my research. So my team and I had an almost 1 hour long conversation with her about her research. So basically, what she did with her research, Dr. Smith is a trauma surgeon. She's a trauma surgeon at Grady Memorial Hospital in Atlanta, Georgia. She's also a researcher, and she's very passionate about public health. She also teaches public health at Emory. So what she did was she does a lot of research on the social determinants of health. So she looks at factors that can either prevent injury or cause or lead to injury. So one of those social determinants of health is food insecurity. So what she decided to do was to see if there was a relationship. So how she did that was she looked at census data. She looked at other types of government data around food access, communities and food access. When she looked at the maps, those maps, and then she looked at the addresses of where survivors of gunshot injuries lived, she found that where there was insufficient food access, there was also gun violence. So she was able to make that connection. We were so grateful to have met her because she connected the dots for us, because we do our work and we're very proud of the work we do. But sometimes you're thinking, oh, this is great. We're going to feed families. But she helped us see that there was a bigger picture to all of this, that because we're trying to feed families, perhaps we're putting ourselves in a situation where we're helping someone to not have to pick up a gun and to go rob a store because they need money to buy food. So that was really profound for us. I mean, we had a wonderful discussion. There were a lot of takeaways. And we talked about the importance of the community in helping gunshot injury survivors heal. We talked about the importance of good food access, because she said, and she's absolutely right, when you ask folks if they have access to food, they'll say, oh yeah, so of course I do. And it's, sometimes it's fast food. It's not necessarily nutritious food. So what she also got to in her research paper was showing that even if folks had transportation to a supermarket, in many cases, they couldn't afford to buy the food that they needed. So she looked at all of those factors. So she was thinking about the importance of doing things like screening, so we can see, the depths of the issue, the problem around food insecurity. She talked about the importance of creating culturally relevant screenings. And she talked about the importance of, medical providers maybe creating different types of food interventions specifically for gunshot injury survivors. So something that she talked to us about was like working with the family, not just the gunshot injury survivor, but working with the family to expose them to resources where they can get nutritious food, teaching them, healthy recipes, because she said that, the foods that gunshot injury survivors eat, they're very important because they can help, with the healing process. So it's very important for them to be able to eat the right foods, nutritious foods.
That is so important. And the other view that the Dr. Randy have put out there is so important. You could put a market in the middle of the city, but if they can't afford it, they still will be malnourished. How can people get in contact with you or your project?
Sure. So people can go to our website, Bebashi. It's www.bebashi. That's BEBASHI.org. So we're bebashi.org. And again, I'm Janice Tosto, and I am the HES project coordinator. So you can reach me. Our phone number, if you'd like to call, our phone number is 212-769-3561. My extension is 142. And again, you can give us a call if you're interested in our services.
Ms. Janice, thank you so much for your time and your information.
Thank you so much. I apologize for the the malfunction, the headphone malfunctions here.
It's fine. As long as we can hear you. We appreciate all that you're doing in the community, and thank you so much again.
Thank you so much, Amanda. Have a good evening.
Thank you for tuning into this episode of PhillyCAM Voices. You can watch us on YouTube and on Roku, and follow us on Facebook and Instagram. That is it for tonight's show. That was good information, some good stories, and we will see you next time.